Ladies and gentlemen, welcome to this special COPD live virtual event, brought to you by the Lung Health Foundation in partnership with AstraZeneca. We're here to acknowledge World COPD Day and shed light on how to better live with COPD, chronic obstructive pulmonary disease. I'm your host, Jake Cohn, and we've got an incredible evening ahead. Now, a little bit about me. I am a severe asthmatic, I'm a professional athlete, but I don't have normal asthma. My lungs look like they have COPD. I have 25% lung function and suffer from chronic low oxygen saturation. So I can relate to all of you who are watching what it feels like firsthand to have COPD. Jessica?
Yeah, thank you, Jake. Thank you for sharing your story. We're so happy to have you here. I'm Jessica Buckley. I'm the president and CEO of the Lung Health Foundation. And before we begin, I'd like to do a land acknowledgement. The Lung Health Foundation would like to acknowledge Canada as the land of the First Nations, Inuit and Métis. LHF would like to pay respect to the Indigenous peoples, past, present, and future, that continue to work, educate, and contribute to the strength of our country. The Lung Health Foundation would like to recognize land that is shared through historic treaties, developed through contemporary treaties, and agreements of land that continue to be unceded territory. As the Lung Health Foundation moves forward, we commit to learning from Indigenous knowledge keepers and working in solidarity with Indigenous communities to build a more just and equitable society.
Over the next hour, we're going to dive into numerous facets of COPD. We're going to go down avenues of how to manage your symptoms better and how to live a fulfilling life. We're going to be joined by many inspiring individuals, doctors, psychologists, many people from the Lung Health Foundation, and we're going to learn a whole lot. So if you have any questions or want to actively participate, and I encourage that you do, please feel free to use the chat. We have a dedicated team of certified respiratory educators ready to help.
I want to acknowledge our partners and our sponsors of this evening. A heartfelt thanks to AstraZeneca for making this evening possible.
I'd also like to note that the advice given here today is intended for general information purposes only. You should always seek guidance from your healthcare professional before following any recommendations. So, get ready for an evening of empowerment and knowledge. Our goal is to provide you with the tools and information you need to thrive while managing COPD. So Jessica, let's go have a seat.
Okay, great.
Jessica, thank you for joining us today. To kick things off, can you tell us a little bit about yourself and what you do as the president and CEO of the Lung Health Foundation?
Thank you, Jake. So as the CEO of the Lung Health Foundation, we are committed to the lung health of Canadians. We're a national health charity, and 1 in 5 Canadians suffer from lung disease. So our role is really to be in between the healthcare system and the patients and offering support to people living with lung disease.
And why is World COPD Day so important?
Well, COPD is a very prevalent condition that most people don't talk about. So it's something that's kind of been overlooked for many years and as a result underfunded. And we're just trying to bring light to this condition and that so people living with COPD can live well. I don't think a lot of people think about their lungs, until they have a problem, right? We sort of take them for granted and people think about, their heart. But lungs are one of those things that we know that we can't live without them. We're just not thinking about them like we were. Now, recent events like wildfires and of course the COVID-19 pandemic have, brought the focus back onto lungs. But 1 in 5 Canadians suffer from some type of lung disease. So it is very prevalent and we just need to be paying more attention to our lung health.
So I understand that you recently traveled to Ottawa to do some advocacy. Can you tell us a bit more about that?
We did. So the Lung Health Foundation coordinated with like-minded lung health organizations from all across Canada, and we formed what is called the National Lung Health Alliance. So this was different provincial lung foundations and some other national lung organizations, and we really wanted to get to Ottawa and sound the alarm bell around lung health. It was important for us to have an advocacy day on the Hill. It stretched over 2 days with meetings with all parties, as many people as we could get to meet with us and really talk about the fact that lung health has been overlooked. It has been underfunded. 1 in 5 Canadians are living with lung disease in this country, and in the wake of the wildfires and the pandemic and everything else that people living with lung disease are contending with right now, we really wanted to bring attention to those issues.
Can you tell us why funding and donation is so important in the fight against COPD?
Well, the Lung Health Foundation is a national health charity, and interestingly, in the Canadian health system, charities play a very large role in giving that patient support, as well as funding things like research. And research is so fundamental to learning more about lung disease and helping prevent lung disease and treatments for lung disease in the future. So the funding that comes into the Lung Health Foundation goes directly into patient programs that help people living with COPD. Our advocacy efforts with the federal and provincial governments, research and awareness campaigns, of course, too, because awareness about lung disease and being tested and early diagnosis is so important.
Are there any other thoughts that you'd like to let us know about COPD or about World COPD Day?
Well, we're thrilled to be able to celebrate World COPD Day and bring awareness to this condition. Also to embrace not just the disease, but living well with the disease. And that is the impetus behind this segment and this program, is that just because you have COPD, it doesn't mean that you can't continue to live well. It is a chronic condition, but it doesn't mean that you have to stop enjoying your life. And so I think that that's really important, and we're really proud at the Lung Health Foundation of all the patient programs that we offer. Our Fitness for Breath program is geared specifically for people that are living with COPD. We also have many patient supports that help people from the time their doctor tells them, okay, you've been diagnosed. It's sort of like, well, now what? What do I do? What do I need to know? And the healthcare system, it does an excellent job to a certain point, and then you're kind of on your own. So that's really where our certified respiratory educators come in, and our lung health coach, which is a program where you get one-to-one counseling about your respiratory condition. And we're very proud of those programs to help people living with COPD.
Yeah, that's pretty amazing that the Lung Health Foundation can do and offer programs like that. Well, anyway, thank you for letting us know and chatting with us, and it's been a pleasure to talk to you.
Yes, you too, Jake. Thank you.
Our next guest is Dr. Wald. He's a pulmonologist who works at the Firestone Institute. He's focused on providing care for patients with COPD and as well as helping them with rehabilitation. Dr. Wald, thank you. There's been some updated guidelines about COPD. Can you share or touch on anything related to that and how it can affect patients?
Absolutely. So yes, the Canadian Thoracic Society recently released the new guidelines focusing on medical treatment for COPD. And one of the biggest updates to that is that we've actually endorsed inhaled therapy containing 3 different agents, so 2 bronchodilators and an inhaled steroid. And for the first time ever, we've been able to say that that treatment in certain patients who are at high risk can actually reduce the risk of death in COPD, which has been a really big event for us, because there's been a long process of trying to discover if there's medical therapies that can actually change mortality in COPD, and this is the first time that, based on 2 recent large studies, that we've been able to endorse that for that specific population. So that's been very exciting for us.
And those are all inhaled medication?
Exactly. So, and they're 3 different agents, but they can sometimes be delivered as combinations in a single inhaler.
So what are some of the cardiovascular risks with patients with COPD?
So COPD patients if they have very severe disease, can develop pulmonary hypertension, and sometimes we do prescribe oxygen in patients whose oxygen levels are low to help prevent that. But in fact, even beyond that, we know that cardiovascular events like heart attacks and strokes are actually a pretty big risk for people with COPD. In fact, more people die from that when they have COPD than die from respiratory disease.
Really?
So having COPD is a risk factor for those cardiovascular events. And what's really been exciting about some of these therapies is what we've discovered is that these exacerbation events where people get sick, they have bronchitis or pneumonia or episodes of increased breathlessness, those are actually risk factors for heart attacks and stroke, and that's where some of these medications, including the inhaled therapies, can actually reduce the risk of heart attacks and strokes if we can reduce those exacerbations in patients who are at high risk.
Yeah, that makes sense. Preventative care rather than just reacting to some of those events. Mm-hmm. Could you give any suggestions for patients that are showing up to their doctor's appointment with COPD? What can they expect? How should they prepare to go into that visit with their provider?
Doctor visits are really important, and it's important to try to get the most out of them. Simple thing, always make sure that you bring an updated list of your medications, because oftentimes if something has changed, your specialist may not know if they weren't the one to do it, and that can affect the other treatments you might be on and things like that. I always say if you have questions or things that have come up since your last visit, to write them down, because it can be a short appointment, and you want to make sure that you have your questions answered. And sometimes if things are busy, you forget something, and then it can be hard to go back. So having a list of the things you want to ask can be really valuable. And then the other thing is, I was mentioning about these exacerbations being really important in COPD, and that's been a real change in our guidelines to try to emphasize treating and identifying those exacerbations early. So I always would say to patients, if they've had episodes of worsening of their symptoms where they have more cough or phlegm or breathlessness that's lasted more than a day or two, especially if it's led them to need to take an antibiotic or go to a walk-in clinic or an emerge, that you should let your doctor know about those episodes, because that may be an exacerbation. And if you are having exacerbations, then we would try to change or increase your therapy to reduce your risk, because those patients are at the highest risk if they're having those events. So making sure to tell your doctor about them, because sometimes people don't realize what that is or how important it is, and so they don't share that with the doctor, and then we don't always know about it, and so then we can't prevent that risk.
So are there any tools that a patient can use to prepare for their upcoming visit?
Yeah, absolutely. So the Lung Health Foundation has a checklist that you can access. So there'll be a QR code available. You can scan that with your phone, and it'll give you a link to that, which can give you some ideas as to how to prepare. I find in general a few things that I found really important for my patients is to make sure they have a list of their up-to-date medications, because oftentimes people think that those changes are being communicated to all your doctors, but sometimes that may not be happening. So it's good to make sure if there's been any changes that you have a list so that everyone knows what you're on, because obviously there can be interactions and things like that.
Well, doctor, thank you for sitting down. Thank you for your insight, and it was good talking to you.
Thank you so much.
Our next guest is Jessica Sitt. She's a certified respiratory educator with the Lung Health Foundation and has worked at various clinics with asthma in hospitals and works with a lot of patients. So thanks for showing up.
Thanks for having me.
Can you share with us what your role as a CRE, as a certified respiratory educator, is?
Yes. So a certified respiratory educator is a health professional, such as a respiratory therapist, a nurse, or a pharmacist, to name a few, that has a specialized certificate in providing respiratory education. What we do is we work really closely with your healthcare team to make sure that your lung disease is well managed and that you're living your best quality of life with lung disease. So some things that we do during your appointment is offer a spirometry test, which is a really simple lung test that helps diagnose asthma or COPD and monitors your lung function over time, teach you puffer techniques to make sure you're taking your medications properly. So we also provide self-management tools, such as creating a COPD action plan or teaching you breathing techniques or mucus clearance techniques. We also act as a community resource to help connect you to various programs in your neighborhood, such as smoking cessation clinics, exercise groups, or support groups.
I know all of those well. I'm very familiar with the spirometry. Can you explain what is COPD explain exacerbations and explain what someone can do when they're having an exacerbation.
So COPD stands for chronic obstructive pulmonary disease. It's made up of two things in your lungs, emphysema and chronic bronchitis. Emphysema is the damage of your lung tissue in your lungs due to exposures to maybe smoke, irritating gases, or particulate matter. And chronic bronchitis is the inflammation in your airways. Together, someone with COPD may experience shortness of breath, typically overexertion, mucus production, cough, and wheeze.
And what can they do in some of those situations when they're noticing the shortness of breath, when they're having a COPD exacerbation?
Right, so an exacerbation is basically a flare-up or worsening of your symptoms, typically over 2 days. When you're in a flare-up, you're going to experience a worsening in your shortness of breath, or you may notice changes in your sputum. So if you were to be in an exacerbation, you should be referring to your COPD action plan if you're provided one by your healthcare professional. In that plan, it's going to help you recognize when you're in a flare-up and what to do and what next steps to take. If you don't have a COPD action plan, you should be taking your puffers and seeking medical attention to help you manage your symptoms and prevent it from getting worse.
What are some pro tips from the Lung Health Foundation that you can offer people with COPD or offer the
Yes.
viewers here?
So the Lung Health Foundation offers a large array of different programs, services, and tools that can really support you in your lung health journey. One of the newly launched programs includes My Lung Health Coach, which connects people living with COPD to their very own certified respiratory educator virtually. This is particularly useful if you don't have access to a respiratory educator in your immediate health team. And virtually, they help guide you and provide you information over 6 weeks and discuss various topics that may affect your breathing.
And they can find that on the Lung Health Foundation website.
Exactly, yes. If you go to our website, you can connect to our Lung Health line, and they will connect you to a respiratory educator and connect you to all these programs and services that we offer.
It's really interesting and exciting to see how far programs like this have advanced from when I was a child, because it definitely would have helped me when I was growing up.
Exactly, and all these programs and tools and information that people have access to is really to help empower you and enable you to know your disease better and to live your life to the fullest.
Jessica, thanks so much for sitting down today. It was great to learn about the services offered from the Lung Health Foundation and how it can help people with COPD.
Thanks so much for having me here today.
Next, we're going to be joined by Carrie Dean. She works with the Lung Health Foundation and has a program called Fitness for Breath. Carrie.
Hi.
Hi. Thank you for joining us.
Yeah, no, thanks for having me.
Of course. So you run the Fitness for Breath program. Can you tell us a little bit more about that?
Yeah, absolutely. I just want to acknowledge that when you're living with COPD, what a challenge it is for one to have the motivation or to even understand the why you should exercise. So I just want to acknowledge that it's definitely a challenge, but those difficulties are definitely, if you start exercising, those challenges will get outweighed by those difficulties. But we tend to avoid exercise. So then even doing the dishes becomes harder. And then we kind of go into this repeated cycle where our health is declining as well, same with our lung condition. And so what Fitness for Breath will do for you is it's going to be a very safe space for you to exercise. It's going to kind of teach you the fundamental movements of exercise that are key. It also is an amazing support group and amazing community. So not only is it going to hopefully motivate you and teach you how to exercise safely, but you're going to meet other people that are living with the same condition as you. So it's a really good community to kind of share information, what medication you're taking or what you did maybe in pulmonary rehab, et cetera. So it's an amazing community. So hopefully what we're hoping with Fitness for Breath is that hopefully you'll have less flare-ups with your COPD, hopefully less hospitalizations, and just really giving you better quality of life physically and mentally.
Yeah, that sounds awesome. Would you say that's pretty much the main benefit of it is to, in addition to rehab, but keep you out of the hospital, keep exacerbations down, and just overall better quality of life.
Exactly. And then in turn, hopefully, you can manage your symptoms better by just adding simple movements and as well as breath work as well.
And all of these are done without overdoing it, correct?
Absolutely. And we encourage you and teach you how not to overdo it. But what we teach in Fitness for Breath so that you don't overdo it is we follow this Borg, it's called the Borg scale. And what Borg scale is just your perceived exertion. And so we want you to stay in what we call between 3 to 4. So what that level means is, yes, you're going to feel challenged, but you should still be able to converse. You still should be able to say a full sentence. If you cannot speak while you're exercising, then you're overdoing it. And we don't want you to work that hard.
If there are people watching that are on supplemental oxygen, can they join Fitness for Breath?
Absolutely. And I will have to say almost 50% of the participants in the class are on oxygen.
Yeah.
If you are on oxygen, maybe speak with your respirologist or your respirotherapist if you just have awareness what level what your oxygen should be at when you're exercising. But you will be more than safe to join us.
Well, it sounds like a great program, and I think for everyone watching, everyone here today, that anybody exercise helps, and if you can do it safely, it's really important. So Carrie, I understand that we have a short video of one of your programs. Can you tell us more about that?
Yeah, and so I think one thing that I want when you're watching this video is that the amazing thing about Fitness for Breath, that it's accessible to everyone. If some of the exercises look advanced, we always communicate how we can make it work for you.
Okay, let's see.
It's made me more conscious of the possibilities of my life, not the constraints that my lung disease has given me. So I'm very happy.
The Fitness for Breath program is very unique for the Lung Health Foundation in that it's a program that we can deliver virtually.
So it provides ability for them to access physical activity on a daily basis. We have pre-recorded videos, but the best part is that we have live classes that we're able to offer.
What I find most intriguing about the Fitness for Breath program is the convenience that it provides our participants. It's easy for them to log onto their computer and get access to a personal trainer who's able to give them feedback.
This allows many of the barriers that restrict people with this sort of conditions to be able to take part in something that is meaningful.
Oftentimes people living with lung disease find themselves isolated at home, and because this is a fitness program that you can access from the comfort of your own home, it's really desirable for people.
Oh, I love the virtual classes. I can stay home any weather. We never miss a class.
To learn more about the Fitness for Breath program, visit the Lung Health Foundation website or scan the QR code on screen here. There are currently a few spots left, but the Lung Health Foundation is in the process of bringing the Fitness for Breath program to more places in Canada. So go online, check it out. You can sign up or see if it's a good fit for you. Now we're going to look at the story of Barbara Moore. She's someone living with COPD.
In order to truly appreciate living, you have to become very close to death. My name is Barbara Moore. I've been living with COPD for a little over 10 years. COPD has affected my entire life. I only go out when I absolutely want to. If it's for my grandson, it's okay. I'm extremely lucky to have the support system that I have. My support network is my husband. He supports me. He does pretty much everything for me, and he does all the heavy lifting. Next is my daughter, who is a social worker. She taught me how to speak to doctors to get the best answers and the best results for your questions. Quality of life is important to me. My family is important to me. I'm grateful every single day that I get out of bed because I get to see my family, my grandson. Oh, Hunter's adorable. He is my pride and joy. He is the reason I live. Just knowing that he's coming makes my day.
Our next guest is Dr. Antony. She's a clinical psychologist and works with adults suffering mental health issues and chronic disease. Welcome.
Thank you.
When someone gets diagnosed with COPD, what would you tell them? They're obviously experiencing high levels of stress. It's very scary. It can affect your mental health. What advice would you give?
Well, like with any kind of chronic disease or diagnosis, it's a big major life transition. We know that big life transitions often, right, like what you mentioned, bring up quite a bit of stress. For some people, they can have a tendency to reach out to other people. What can be really important is reaching out for support. So whether that be your family, your loved ones, your friends, or even your treatment providers, really looking at how to build community is going to be really important. Some people might want to reach out to a therapist or a psychologist or counseling professional to really help them think about the next stage, their life, transitions, changes that they're going to have to make in their day-to-day, in their work, in their family life, and all the commitments that they have. So lots of big things. I think one of the most important thing is to have some self-compassion for ourselves in those moments, because we can go to, a negative thinking style of, how come I can't do this, or I need to do this, and that kind of push through kind of attitude. So, really just giving ourselves the kind of compassion that we would to another person.
And could you give any quick tips on how to do that? I know I struggle with that all the time, not being able to do something that I could do before.
Right.
More so in athletics, where it's really hard, and I try to push through, and I know it's not the best for my body. Can you give any quick tips for people struggling like me?
Yeah, I think one of the strategies that we talk about with patients that we work with is to think about what we would say to a loved one or a friend who's going through a difficult situation, right? We wouldn't kind of say to yourself, we wouldn't say to them, what's wrong with you? Like, come on, get it together, let's go. We would probably say something, more compassionate, more caring. Of course, like, this makes sense that you're gonna have to take a step back. Like, it's okay, you're at your own stage of progress, right? Setbacks aren't failures or opportunities for growth. So kind of coming up with some of these, what we call positive affirmations that you can say to yourself in the moment, and really just compassion, really bringing compassion to yourself, and how you bring it to others.
Yeah, I think we put labels to ourselves, and it's really, can be really beneficial to break those labels. It's very hard to do, right. But I think it's very important. How can we kind of just touched on this, but expand a little more on how, when someone with COPD, or in my case with a low lung function, a missing lung tissue, and I get really scared, I get anxious, I have chest pain, whether it's from low oxygen levels or whether it's even from GERD, or people with COPD when they're wheezing or they can't breathe, and they're really scared. What do you tell those people? Do you have any advice you could give them?
Absolutely. Well, we know anxiety and depression are quite common with individuals who experience COPD. And we know that anxiety symptoms, of one of the first ones, is shortness of breath, right? So you can get kind of stuck in this cycle where you're experiencing shortness of breath, and then panic can kind of increase. So one of the kind of helpful strategies that we talk about as preventative is around mindfulness or meditation and daily practice. We see in the research that mindfulness has a significant impact when practiced daily on reducing overall stress and really helping our nervous system start at a lower set point, and those are the kinds of things that can activate our shortness of breath. So one of the strategies can be also just telling yourself this is not going to be forever, I need to take a deep breath, I'm going to be okay, I have coped with this before. So back to those kind of positive affirmations, but also daily practices, similar to how you take medication or a vitamin, to really practice mindfulness. We see in the research that it is effective over time, but it's something that you'd have to do daily versus in the moment, right?
Well, Dr. Antony, thank you for the quick chat. And to anyone listening, mindfulness is very important, and it's not woo-woo. Our next speaker is Kat Kova. Kat is a sex therapist. She's the founder of Kat Kova Therapy here in Toronto, and she's currently getting her PhD from York University. Kat, thanks for coming.
Thanks for having me, Jay. Pleasure.
So, can you tell us a little bit more about what you do?
Yeah, I am a sex and relationship therapist, which doesn't mean that I exclusively work with just sex and relationship issues. We talk to clients about anxiety and depression and PTSD and all sorts of things. But we kind of put it out there that we do also talk about and welcome people talking about sexual health issues, because oftentimes people have a really hard time opening up about that. So they know it's a safe space to talk about it.
How can someone with COPD better communicate to their healthcare provider about sex or about the relationship or about issues they may have?
Yeah, absolutely. So people with COPD are actually much more likely to have a sexual concern than people without COPD. And they may also really feel anxious about talking to their doctor, but their doctor, rest assured, has talked to patients about sexual issues before. And you can just acknowledge that it's a little awkward and say like, hey doc, I know this is a little, spicy or awkward, but I need some help here. And it's actually really important for people to talk to their healthcare providers about sexual issues, because a change in one's sexual response can often be one of the first symptoms of an underlying health issue. So for overall maintenance of your health, definitely open up to your healthcare provider about this.
How can they maybe redefine their expectations of reality from maybe what they used to be able to do in a relationship,
Absolutely.
in the bedroom, to now maybe what the reality is?
Yeah, absolutely. So a lot of people that come into my office have something called a performance mindset, where they're thinking about what sex should look like, what they should look like, what is permissible inside of that interaction, what's not. And I think in this way they lose like 90% of the experience, right? Which is all about feeling and sensing and connecting and relaxing, and maybe using sex as a way to cope with life's difficulties, right? And using that connection to be more resilient. But it can be really difficult to make that adjustment because you may not be able to do things the same way anymore, but that's okay, because maybe that opens up the possibility for lots of other things that you didn't think about before, right? And adjusting so that you're not physically straining or doing anything that might put you at risk. And then just allowing yourself to really be in the moment. So having maybe a mindfulness practice, or doing something called sensate focus, which is something you can do on your own or with a partner, where you're training yourself to refocus on the sensation as a way of getting away from negative thinking.
So kind of transitioning, what are maybe some strategies on promoting a positive body or self-image for people with COPD or with any disease?
Absolutely. So first, just examining like, what is my relationship to my disease, or what is my relationship to my changing body, which again, like all of us are going to have to go through at some point in time. And some questions to ask yourself are like, how can I look at this differently? Is there part of this that is helping me in some way that I can be grateful for? Is my body that is now aging, or that now has a disease, has that served me well in my life? And
our bodies,
that's right.
They do serve us well.
That's right. Or how can I be grateful for every breath that I do get to take, or have some device helping me to take, so that I can still enjoy what's here.
Are there any tips and tricks from the pros that would help people with COPD, talk to their partners, and maybe it's not a long-term partner, maybe it's a new partner, maybe you're getting into, meeting someone on a dating app or whatever it is, and I think a lot of this anxiety maybe comes with people who don't have a partner and are looking to meet someone, or when they meet someone they're embarrassed. So what could you say to those people?
Absolutely. Okay, so it turns out that sexual communication is kind of unique in that in relationships, it could be with somebody new that you just met or somebody that you've been with for a very long time, that conversations about sex tend to exhibit greater warmth from people than non-sexual communication or types of communication. And in my own research, I found that when people disclosed something about their sexual self to a partner, there was like an overwhelmingly positive response. About 80% of responses were either like enthusiastic or just plain responsive, supportive, non-judgmental.
Kat, thank you so much. It was great to talk to you. Everyone stick around. We have more coming. Our next guest is Chris Ford. Chris is an independent consultant that helps individuals, families, and businesses manage their money. Chris, thanks for coming.
Thanks for having me.
Jump right into it. What are some solutions for families needing help with finances related to COPD?
That's right. I mean, often the financial burden of these diseases can be worse than the disease, or at least as scary as the disease itself, right? And so, certainly everyone should always have a financial plan in place, but if you don't, simple budgeting or, attempting to get, your head around what your financial picture looks like would be the first place to start, right? So, for someone that has the means, an affluent or high net worth person, this is less of a concern, and quite often they already have a financial plan in place. But for someone where their financial situation doesn't accommodate this and they're scared and worried, there still are solutions, right? And options to get a plan. So something as simple as, if they have an advisor, certainly talking to a financial advisor. But if they don't, just going to your bank, there's often, financial snapshots, which are kind of abbreviated versions of a plan. And then there's also, some online solutions. But really this is around, looking at your expenses, how this affects your income and ability to earn, and then measuring that against, some of the expenses that you're expecting down the road.
Are there any insurance solutions for those dealing with COPD, or can you touch on that? Do you know much about the insurance side?
Sure, yeah. So, insurance is often a part of an overall financial plan, right? Okay. So, if someone, I mentioned employee benefits earlier, and so quite often, someone who has employee benefits will have critical illness insurance built into that, right, which COPD would qualify for. For someone who doesn't have employee benefits and has not purchased critical illness insurance on their own prior to diagnosis, there still are some options, right? So COPD does not disqualify you from life insurance. So even if you haven't purchased life insurance prior to diagnosis, you can still qualify. Now, every provider is different and every solution is different, but it does not immediately disqualify you, which is a huge plus, right? So, quite often when someone is diagnosed with any ailment, of a serious nature, they start to think about, what are my loved ones going to do? What am I going to do down the road? And so, insurance is still an option even post-diagnosis,
Leading into the next question, are there assistance from the government for medical expenses outside of insurance? Would that fall into that avenue?
So in terms of assistance from the government, it's not direct dollars, right?
Okay.
So
They're
it's
not giving you a check.
Right, it's on the tax deduction side. So it's a disability tax credit. Typically, in order to qualify for a disability tax credit, you have to have been managing your issue for at least a year, and then you need to show that it is affecting your day-to-day life. And there are, it's actually very fluid in terms of what those metrics look like, but there are provisions in place to be able to measure it.
Is there anything else that you'd like to suggest on this topic for the people watching?
Yeah, so a traditional financial plan, proper budgeting, certainly employee benefits and what those look like, being able to gauge where you can find assistance through those benefits. I mentioned the tax credit, but there's also alternative ways of raising money if you're in need. And, family, right? Community groups, church groups, crowdfunding, but certainly your banking partner, right? Your banking partner should be where you start. if you don't have an advisor or you can't afford a third-party financial plan, that bank manager or financial services manager can walk you through this to a point, right? But leveraging your family, your friends, your network, it's pretty important.
Chris, thanks for stopping by. I know I've learned a bit, and I'm sure it's been beneficial to our viewers, so I appreciate it.
It's my pleasure. I hope it helped.
What an incredible journey we've had tonight. We've discussed important topics, had esteemed guests visit us. It's been pretty amazing. All for World COPD Day. And thank you to the audience. Thank all of you guys for tuning in, for taking your time to celebrate and support World COPD Day. And before I say goodbye, I'd like to thank our sponsor. AstraZeneca has made this event possible, and without your partnership, none of this would have even happened. The partnership with AstraZeneca is important because it improves the lives of Canadians living with COPD. I want to thank all our esteemed guests who sat in this chair next to me. We had some great conversations. I learned a ton. I hope everybody in the audience also learned a ton. And I look forward to working with these guys more, to talking with the Lung Health Foundation about how we can further research and further support for patients living with COPD. This event, brought to you by the Lung Health Foundation, is a positive step forward for making people's lives better who live with COPD. If you'd like to receive more info, we invite you to check out the Lung Health Foundation's website at lunghealth.ca. A recording of this event will be posted live on YouTube. It'll be available on the website. It'll be very easy to find. So, I ask you, the audience, please stay connected. Reach out for support. Talk to people, talk to family, talk to friends. Your life with COPD is very manageable. Make each day brighter, healthier future, and for all those living with COPD, there is hope. Thank you. Goodbye.